ladies for joining me once again. I'm here with Adwoa Danso, Dr. Adwoa Danso, and I'm with Pharmacist Nina Bobie. Thank you once again for coming on the Health Dialogue. So today we will be looking at smear test, which a lot of some ladies find it hard to go for their smear test. So I was looking at some reports, and women are generally invited every 3 years, but 1 in 4 women skip the cervical screening, and there are a lot of reasons. Some is due to embarrassment of the body, some are scared, but we'll get into further with that. But I would like for us to look at the importance of having your smear test done and the effect it can have on you if you don't have it done. So Adwoa, I would like to come to you first. So why is it important for us to have our smear test done?
So the smear test is basically looking at the cervix, which is kind of like a donut-shaped structure at the bottom of the womb, and sort of between the vagina, end of the vagina and beginning of the womb. And it basically looks at early changes that can pick up cervical cancer. So it's extremely important. You know, we are in a country where this is offered for free. Many other countries, it is not offered, it is paid for, and it's not detecting cancer. It's really important. It's detecting pre-cancerous cells. So it's a great opportunity to get things looked at, which seems nice and early.
So what does the procedure entail, Adwoa? How many years? I know some people get it once a year, some people get it three years.
In this country, the screening program starts at the age of 25, and you have it every 3 years. People that have yearly checks are usually put onto that schedule if they have seen any abnormalities before that they need to be seen more closely. But the majority of people will be on a 3-year recall program. And in terms of what happens, so that the smear can be done at any GP practice. Doctors can do it, practice nurses can do it. I used to have actually some samples here, but I forgot to fish them out somewhere. But basically, a speculum, which is like a plastic device. I've got a video on my Instagram actually that might be helpful to see. It's like a plastic kind of a duckbill that goes in, and then it opens up gently into the vagina to visualize the cervix, which is like a donut shaped, almost looks like looking through a little hole like that. And then a little brush is inserted gently. And when I say brush, it's like really soft, like a soft, bristled, tiny little brush that's inserted, rotated into the cervix to make sure that we get a really good sample. And then that's it. We take everything out and we send the sample off, and it gets tested.
So I know obviously we're all women. Nina, you I'm sure you've had yours done a few times. And
yeah,
do you think it was invasive or painful when you had it done?
So obviously when you're going to get it done, you're nervous and you think, oh my God, do I have to spread my legs really wide and things like that? But it's not like that. You can actually sit in a comfortable position. Your legs don't have to be really wide, just wide enough for the sample to be taken. And it really isn't that invasive. You're not, obviously clothes have to be taken off from your waist down, or if you're more comfortable to wear a skirt or flowy skirt, and it's over in a matter of minutes. So I wouldn't say it's too invasive, but obviously they need to get to your private part to get the sample. It's not too bad. I didn't find it too bad.
So Adwoa, what would you say to the people that find it hard? Obviously, like I did say at the beginning, due to embarrassment of the body.
Yeah.
Even in the research, some went to the extent of saying due to sexual abuse they might have had previously.
Yeah, we know that people that have had previous sexual abuse, or people that have had female genital mutilation, and are people that are not keen to have this done, which is understandable to an extent. But I think what I would say to encourage many people to do it is there's lots of things that we can do to help you understand it. So speak to somebody about it. So I'm more than happy to, and I have spoken to some patients, shown them what we use in an appointment, show the instruments that we use. That often helps. You can actually go with somebody as well. It might help you to go with somebody to your appointment as well. That's completely fine. I always think as well, like Lena said, flowy skirts are actually I think make people feel more comfortable, because I think also the idea of like changing like in a room with somebody else
Makes
is a bit
you
weird.
nervous,
It makes you nervous, whereas you can just kind of lift up your skirt. I guess there's less to do, you don't get so flustered. And I think the other thing is you can ask somebody who you have a good relationship, or maybe not a good relationship with, I don't know, it depends, to do it for you. So lots of practice nurse does do it. I mean, the practice nurse that does mine, I know her, which I don't know, maybe it's weird, maybe it's not, I haven't thought about it too much, but you know, we have meetings together. She, you know, it's not, I don't get embarrassed about these things, but I guess I'm a doctor, so it's a bit different. But I think, you know, maybe somebody who you know well, or sometimes not knowing well. People say like getting a wax, isn't it? You want someone that you don't know to do your wax. I don't know. Some people prefer not knowing the person or not having to ever see them again. So maybe it might be worth asking for maybe not your usual doctor, or your usual doctor, or your usual nurse, or not your usual nurse, whatever makes you more comfortable.
What are the risks some women may experience if they do not take their smear test?
So as Dr. Adwoa said before, having a smear test is you're not searching for cancer, you're looking for ways to prevent. So we have something called HPV present downstairs, and if it's disproportionate, if you've got a higher level, I think it means that you're more, correct me if I'm wrong, doctor, it means that you're more prone to getting a type of cancer downstairs. And what they do is we take this swab to predict whether it's going to increase the likelihood of you getting the cancer or not. And then when you do have the risk factors before you can then prevent. So you're not treating a cancer, you're preventing the likelihood of getting cancer. So by not taking the test, you actually throw away all these chances of you finding anything wrong downstairs in time. So you'd rather prevent than cure, right? So prevention is better than cure. And having a smear test is a way to prevent any complications in future rather than going for a cure. So that's why we actually do the smear test.
Okay. Yeah. So just to add to that. So the HPV, which you mentioned, Nina. So HPV is human papillomavirus. So we know that some people who have the virus are more likely to have cervical changes, or can cause more cervical changes. So we definitely know that. But so when we're doing the smear, we're actually looking for any precancerous cells. And we also test, it's like two things as well. Then we also would do a test for HPV, because we know that can predispose those precancerous cells to turn to cancer. So you're either HPV positive or not. So you either have it or you don't. So if you have it, yes, you are slightly more at risk as well, but you can still get precancerous changes without HPV.
Okay.
Yeah.
More than 3,200 women are diagnosed with cervical cancer every year in the UK, and nearly 900 die annually. And that's a very high proportion, Adwoa, of women dying of that.
Yeah, that's a huge number. And I think we're seeing, again, younger and younger people being diagnosed, which is why, you know, people are campaigning to perhaps lower the age of screening from 25 to a younger age, because we might be missing a window of people that are affected. But I think also another reason why the numbers are increasing, you have to ask, is it because we're actually detecting more? So the numbers larger because we're actually doing more screening. When Jade Goody died, unfortunately from cervical cancer, so Big Brother contestant, there was a huge uptake, so the numbers went up drastically. And I think last year was the first time that it had dropped since then. So unfortunately, it takes someone to pass away, but she was such a popular person You know, many people had never heard of cervical cancer until she passed. So lots of people were checking, but unfortunately since then the numbers are dropping as well.
So would you say so for instance, people that do it every 3 years, whether you go for a checkup or not, you can still get it, right? That's what I want to know.
Yeah, I mean, the reason why it's 3 years is because it's unlikely to change for changes to occur that quickly. So 3 years is kind of optimum time to see if changes. 1 year might be is probably too soon. So 3 years is a good time. But I think, yes, you can get something in between, but you may have symptoms. So it's really important to know what some of those symptoms may be of cervical cancer, which I can quickly go through if you'd like.
Yeah, that's fine. Yeah.
Yeah. So you can get so common presentations of cervical cancer are bleeding. So bleeding outside of your period. So bleeding in between your period. Bleeding after sex, again, very, very common as well. So bleeding after sex can happen for lots of other reasons as well, but it's never good to be ignored. It's better to get it checked. And as I said, it's easy to get these things checked out rather, to be safe.
Yeah. Is there other ways the test can be done?
So clinic, it has to be in a clinic. So GP surgery is really the only place you can get it done.
Can you get it done in a gum clinic?
I don't think they do it at the gum.
They don't do them. Okay.
No, I think they only check for now, because I think they would refer back if there was any other thing, and then we do, because you have to actually have a special PIN and a code to send for screening.
So Fanny, what's the message that you give out to the young ones out there? I know people are scared to go and get it.
Well, I think the first thing I'd say is coronavirus shouldn't stop you having smears. We're definitely open. Our nurses are doing smears at our surgery all the time, so don't put it off. Just get it done, book in, and try not to be too embarrassed. I know that's really easy to say, but genuinely, like, I don't go home and think about people's bits or anything like that. I have other things to think about. But I know sometimes I say that to my patients, and that kind of breaks the ice. I'm like, I promise you I'm not going to remember this. So that kind of breaks the ice. So don't try not to be too embarrassed. And we have seen everything. Yeah. And I feel like I have seen everything, although I don't remember it.
It's so funny how you said that, because we tend to have that conversation where we say, how do doctors, like, they see different types of, down there? Don't they get pictures when they are at home?
It's funny because people will come, well, maybe it's not funny, but people will be like, oh, it's such an embarrassing problem. And I'm thinking, gosh, what on earth is it? And then they say it, and I'm like, oh, is that what it was? And I'm like, no, that's not embarrassing. No, don't be embarrassed. But yeah, it's different, I guess, because I speak about embarrassing things all day, every day. So I guess it is different for me. But honestly, your doctor is genuinely not. No, I don't think anything can embarrass me anymore.
Let's talk about female hygiene. Does a woman's private parts need to have a certain smell? If not, how can you tell if that smell is healthy or not? What does a healthy vagina need to smell like?
That's a really good question. And like Nina said, just water. And, I think we are brought up, especially Africans, to do all sorts of things down there, talcum and soap, and all of these products are so unnecessary, and it strips away. Look, your vagina is not ever supposed to smell like roses. That's not what its purpose is, at all. So I think what's important to say is that you have good bacteria and bad bacteria, and you need that balance to create the perfect environment for the vagina. So even those products that are marketed towards feminine hygiene, all the sprays and the powders and the washes, they just strip away some of the good bacteria that's there. So once that balance is distorted, then you just get an increase of the bad bacteria, and that's what leads to things like bacterial vaginosis, which causes really strong fishy odor, and that's not that's not how it's supposed to be. So water in itself is something that, you know, Nina mentioned. We have to really have to stress that that's all that's needed. And to answer your question, what's it supposed to smell like? I don't know what it's supposed to smell like. It shouldn't make you feel repulsed, you know, or feel like the fishy smell is not supposed to be like that. But I think also people get really obsessed with how they smell. I've had patients that come in to be like, I smell, and I'm like, nope, can't smell anything, you're fine. So I think also when it's you become more aware of yourself. So there isn't a certain scent, but I think also eating well is really important, because if you are having a really balanced diet, it's, you know, you're keeping that balance down below as well. If you start to eat lots of sugary things or really lots of processed things, you are again distorting the balance down below as well. Yeah. And drink plenty of water.
So Nina, with what are some of the things that women need to avoid to stop them from getting irritation on your private part, especially types of knickers, not dodging too?
Yeah. So like I'd say cotton knickers. I think sometimes they rub against like the vulva and they can cause irritation. So cotton knickers wouldn't be a good idea. Using perfumed products as well. As doctor said, it will just strip everything downstairs. That can cause irritation because there's an imbalance in the pH, and you've taken away the good bacteria. That can cause some issues or uncomfortableness downstairs. Tight trousers. So if you're wearing trousers that are tight or tighter than usual, they can cause your knickers to rub against your vulva, and that can cause issues and a little bit of a rash if you're itching there as well. I think silk knickers are the most comfortable to be in, and I think your vagina would really appreciate some silk knickers if you're not allergic to silk. What else? And eating, as Dr. Adwoa said, eating well is great, like pineapples and just nice fruits and things might make you smell better downstairs if you're that conscious. Pardon?
I heard about the pineapple.
Yeah, apparently it makes you smell better downstairs. So,
and bigger knickers, you know, we like to wear lots of G-strings, thongs.
Yeah, those thongs. Things like
bigger knickers are okay too. Okay, so as well.
But we're talking about our everyday wear. You don't want to. You don't want to do that every day.
And the other thing is, especially when it gets warm, when it gets colder, people get into habits of wearing. I'm saying people. I'm talking about myself. I'm wearing like I'm always cold, so like thermals and trousers and things like that. So just be really mindful as well. Like could get a bit too warm down below as well.
Yeah. So you need to stop putting perfume soaps and all that stuff down there. It's not healthy.
No. Not recommended. No.
Recommended. I don't even know the last time that. Well, there's too much detail. I forget that you're recording something.
I think that it's more of an African thing, like put Dettol in the water and you know it will clean you and things. But I think as you get older and you're more self-aware, you notice that these things are actually causing an imbalance downstairs rather than harm. You feel good whilst doing it probably, but afterwards you're kind of like, it feels different today, and those things do cause a difference downstairs. So
because we feel like when you pour water down there and
you've cleaned it, you scrubbed up really well.
Adwoa, do you want to say something?
No, I'm just
I feel like you've got something, but you don't want to share it.
She's got something personal. She's wondering if it's too personal.
I'm just laughing because I'm genuinely trying to remember the last time that I actually used any other products other than the water. Trying to pin down when that change happened. It's a long time.
Yeah. Our private part is a special thing that needs to be taken good care of. So I'll bring it to an end now. All right. Thank you so much, ladies. I'll let you
No, you're welcome.
All right, thanks.